Okay, hello everyone. Thank you for joining the initial webinar for the Care Director training. As a reminder, we are going live with Care Director for all of our health home agencies on October 1st. So all documentation that represents any activities from October 1st forward should be documented on Care Director. For any agency that is currently using Allscripts Care Management, you will have until October 3rd to complete your documentation for September. And then at the end of the day on October 3rd, everyone's user access will be restricted to view only, so you will no longer be able to enter in any notes or information into Care Management. You'll have to add everything into Care Director. And that way we are lined up for the fourth quarter CMART report. For agencies that are transitioning from GSI Health, your patient demographic information will be uploaded to Care Director prior to October 1st. And October 1st for all of your activities, October and forward, will be documented on Care Director. If there's any questions on the timing of this or what needs to be documented in which system, please let me know. Okay, let's get started. So to get to Care Director, you go to the same website as Care Management. So you go to www.extendedcare.com, and it brings you to this login screen. Right now, I don't have anyone enabled for Care Director in our production, our live, real website. You have to log on to training. The production website is not live until September 27th. So we will let people have access then so that you guys can look at the system for a couple days. But for now, everyone will have access to the training website starting this week. Allscripts periodically changes the password. Your username will be your regular username, and the password was actually just changed to football with a capital F equals 14. That's football with a capital F equals 14. If you log on to the regular site on the home page, it also updates on the around the middle left-hand side, right under that referral panel. It will say what the active training website password is. Okay, so I'm going to log on to the training website by clicking this log on to the training website link under the normal login button. So I'm going to be logging on with a fake care coordinator that username that we have. So it's football with a capital S again equals 14. And it'll bring you to the Care Management site for right now. Once we go live on October 1st, I will change the default to everyone to Care Director. So we're being integrated with the Bronx Lebanon Hospital Center system, and that's how we are going to get all of that clinical data to be coming over. So for right now, we're kind of this, health home secluded entity that has the application, and that's, you can see the health home site says Bronx Lebanon Health Home on the upper left-hand corner. Also, when you're on the training site, please always make sure, if you're going to be playing around and looking, that you see this yellow banner across the top that says you are on the Allscripts training site. If you don't see that, that means that you're on the regular production site, so please don't play around on the production site, only on the training site. And I don't think I mentioned this before. This is a web-based system that works with Internet Explorer versions 8 to 10. If you have version 11, you'll have to use compatibility mode with the application, and you'll know that there'll be a red banner across the top where the yellow banner currently is, and it'll say that Allscripts is not compatible with your browser, and you'll just have to put it into compatibility mode. Okay, so the first step to getting into Care Director is to click on the Home button and click Change Organization. So now we're moving from our previous health home organization into the hospital. And so I'm going to click on Bronx Lebanon Hospital System, and it's going to bring me to Care Director. So this is my home page. There's a few different options you can have for your home page. I'm going to set the default as the patient and work list view so that when you jump into Care Director, it'll automatically go to your patient view. It also has that home page that Care Management has, but since we don't really use that, that's more for the hospital, I'm going to set the default as going right to this patient page. So there's a few icons here on the left panel and up here on the top right. I'm going to go through them. The home page will bring you to either the home page, which is that page that looks similar to the Care Management site, but again, we don't really use this. We're not going to be using the referral function. You can go here to see what the training website password is. You can see right here it says football equals 14. Or you can go to my start page, which is, I have mine defaulted to my patient list. You can also go back to that change organization if you need to go back to the Health Home website. This Manage tab is where you're going to be doing the bulk of your documentation. The Care Director function down here, there's two different lists, an assigned user and patient status list, which allows you to assign users and to change patient statuses in bulk. You can check mark patients that you want to change their status or their assigned users. The work list and patient list is that list that I have as my home page, which shows patients that are assigned to me and my work list, which I will be going over all of this in just a few minutes. The calendar is a neat new function that Care Management did not have. You can add and change things on your calendar and view events. You can edit everything. There's a nice function where you can put things as complete or not complete, and it'll come up in red or green if it's complete. This info button has your profile information, so you can go into your profile information and make sure that you have a valid email address on file. This will help if you ever need to reset your password. As long as your account is not locked, you can reset your password using on the home page here. Once you hit log on, I'm not actually going to be able to since I have the application up. It'll say reset password, and you can click on the link, and it will send you a link to reset your password. Now, if your account is locked, you'll have to go through me. Accounts lock if there has been no activity for 30 days. The account's lock, so if someone has left an organization and we weren't aware that the account will lock, so there's no issues with PHI. So again, go in here. You can make sure that your name is correct and your email address is correct. This help button on the left-hand side brings you to client support and online help. I have access to this as I'm the administrator for our system. So if you find any issues with Care Director, or you think that there's a bug that you found or something's not working right, please let me know, because I have direct access to logging a ticket and calling client support, and I can try to help you through that and get in touch with Allscripts right away. This log off button on the left-hand side is the best way to log off. You will have to go down to log off and then click this log off button here, and it'll log you off. Going over to the right-hand side here, there's another way to log off, which is to click this button on the upper right-hand corner here. This is just a one-step process. You click it and you'll be logged off. So it's best to get in the habit of doing the two-step log off. That way you don't accidentally click there and didn't mean to, and the system will automatically log you off. This refresh button here will refresh the application in case it's ever, taking a long time to load, or you want to refresh the page. You can click the refresh button. This is the back button. It'll bring you to the previous screen that you were on. This is another help button, contact us for Allscripts button. But again, if you have any questions, please go through me. This is the print icon. It will print your view of the application. It's not necessarily a printer-friendly view. Like if I clicked print page right now, you would see this log-off screen, and then you'd see this behind it. So there is an easier way to for printer-friendly assessments and contact and activity notes and care plans, which I will show you later. Okay. So those are the main icons on the left and the right here. So really the icons that you're going to be going into the most and using the most are this Manage folder and this Calendar function. So under Manage, and you go down to Care Director, first I'm going to show you the Work List and Patient List view. So if I click into there, now when you first log on to training or log on to the production site, these lists are going to be empty. They don't have a default view. It'll be on a nothing selected, so you'll just see no work list. So what you need to do is go down to this drop-down box, and there's 6 different views that you can choose from. And as you can see, the home page will be able to display 2 different work lists at any time. So the 6 different work lists are the activity work list, which shows a list of all of your activities, and not just for the day, but all of your activities that are pending. Your all assigned patients are going to be every patient that is assigned to your organization. So anyone who is tagged to your organization, not necessarily just your patients or just someone that you're actually working with, but anyone who is assigned to your agency will be under the all assigned patients list. The My Patients will be anyone who is assigned to you. With Care Director, we can assign a patient to different care coordinators. There's always going to be a main care coordinator or the primary assigned user. But if you are assigned to a client, even if you are not the primary assigned users, they will come up on your My Patients list. My Screening Patients is going to be anyone with a screening status. So in Care Director, screening is like outreach. You're screening them for the Health Home Program to see if they're eligible. So screening is going to be people with a screening status that are not yet enrolled. The new referral work list is going to be everyone who is new. So if their status is new and they are not assigned to anyone yet, they will come up on the new referral work list. So if I get a top-down list from the state, I'm going to send you an email that says I have uploaded the information to Care Director and given you, let's say, 50 top-down assignments. So you could go into your new referral work list and see all the client information, and then the intake coordinator or the supervisor or whoever is in charge of assigning these out to the care coordinators can go in and see these new referrals and go out and assign them to outreach workers or care coordinators. And then lastly, the today's work list will show you all items on your work list that are due on that day. So the way that I like to have it is to have my patients list on top, and all you have to do is choose whichever view you'd like and then click Apply. And then I like to have my today's work list on the bottom. And you can see that right now I don't have anything on my today's work list because I did not assign myself any tasks, but I will show you later how that will change. So my patients, you can see here, it has the patient names, their MRN, their program type, which on training it's a little messy here, but we are going to be using the state-designated program types that we use for CMART reporting. So if you choose which program type the client is in the assessment, it will automatically populate here. You can choose a primary program, which is going to be the program type that the state designates. And as a secondary program, we have bottom-up referral tags so that we know which are assignments and which are bottom-up referrals. The risk over here is going to display their acuity score. So again, in training, it's a little messy here, but we're going to have acuity score. You can also click on it because we're able to put more than one acuity score. So we will have, when we get our assignment list, we have up to 5 different scores that the state sends us, so we will upload those. And also, once you complete the FAFGP in the assessment, that score will generate under the risk score as well. The care team is going to display the primary assigned user. So whoever the primary assigned care coordinator is will be here. And then status. So we have a few different status. Screening is outreach. Active is obviously a client who's enrolled in active. And then there's inactive and deceased, and not started and new. So new will be everyone who I have uploaded as a new client or bottom-up referral. Then they'll be moved into screening. They'll be moved into active if they enroll, or changed to inactive if they are inactive and not in outreach or enrolled. So now I'm going to go over into the assigned users and patient status list. So I'm just going to click on that, and it'll bring me to this list here. So the left panel has a comprehensive search here, which you can either collapse by clicking that little line there or expand by clicking the box. And this list here on the right-hand side is going to be the list of everyone who is assigned to your agency. So you can filter as needed to try to get the group of individuals that you want to either assign to a user or change their status. So for instance, if I want to look and see if I have any new clients, I'll click on the New button, I'll click Search, and you can see I have 3 new people here. So if I want to assign all of them or change all of their statuses, I would click on this checkbox that's on the blue panel here. So if you click there, it will select all of the clients in the list. If you only want to choose a few of them, you can click on the checkboxes next to their name. So now if I want to assign a user to these 2 clients, I'm going to click on Assign User up here, and it will bring up a list of everyone who is available. So if someone is already assigned to those clients, they will not be in this available list. So if I want to assign Romelia, I'll click on her name, and then I'll click Apply. And you can see that it is successful because her name is now under selected users. So I'm going to go back to my list here. So now if I want to unassign users, it's the same way. I would go and filter my list how I would like. I can either click on the top button here to select everyone, or pick and choose as I want and click Unassign Users. So for instance, if you want to go through and unassign everyone who is assigned to a care coordinator that has, moved positions or is on vacation or something, you can click on those users. You'll be able to filter by user and go in and unassign them. So let's say I want to now remove Romelia from those. I'm going to click on her name, and then I'm going to hit Remove. So then this is going to pop up, and you can enter a reason of why you're removing them, if they're on vacation, if they're no longer at the organization, whatever it might be. But it's not required. You can also leave it blank. So I'm just going to hit Save. And again, you can see that it is successful because it says selected users, Romelia Corvacho. So I'm going to go back again. So changing patient status is essentially the same. You can sort the list however you want. And so let's say I'm going to see if I have any not started clients. I don't. Okay. So I'm going to see if I have some screening clients. Okay, so here are my screening clients. Let's say this past today I am an outreach worker, and I was able to enroll 3 people. So I'm going to look at my screening clients, and 3 of these people enrolled. So I'm going to click on their names, and I'm going to click patient status and move them to active, and click Save. So patient status modified successfully. So that's done. And so this tab here, you can't click into the patient information from here. This view is only used for assigning users and changing patient status. You can also do this within the patient profile once we go in, but that you can only do on a one-by-one basis. So this is a good view if you need to change patient status in bulk, or you need to assign users, or you just want to search to find someone. You can use the searching criteria on the left. Okay, so now I am going to go into the calendar and view my calendar events. So the default view here is a daily view. It'll come up whatever day it is that you are viewing. Or you can click into a weekly view and see what's going on for the week. You can also jump around week by week and change by clicking on the calendar up here on the left and choosing whichever date it is that you want to take a look at. So I'm going to go back to this week. And so you can see that I have 2 things on my calendar for this week. On Monday the 15th, I have a follow-up outreach home visit that I have marked as complete, and that is why there is a green line on top. So I scheduled it from 1 p.m. to 3 p.m., and I marked it as complete. I have this appointment here that I put in as a reassessment reminder that I have to do a comprehensive assessment for George McDonald, one of my patients, and I have it marked as not complete, and that is why this red bar comes up on top here. So if I'm looking at my schedule, and let's say I completed this this event, I can click this little green pencil down here to edit my calendar. And so if you want to keep track of your calendar events, your meetings this way, you can. We are not enforcing this as of right now using the calendar. If you find it helpful, if your agency finds it helpful, then that's great. You can connect these to patients, and you can also invite other staff members and coworkers so that you can see each other's calendar events. So the event type is, I have mine as reassessment reminder. I already put in that I have the comprehensive assessment due, and I'm going to mark the outcome now as complete. And I'm going to hit save. And so I'm going to go back to my weekly view, and you can see that it changed to green. So now I know that I went there, it was successful, and that's why it's changed to green. There's a few different outcomes that you can choose. There's also no longer applies other partially complete. So if you had chosen partially complete and gone back to view it, it'll change to a yellow. So if this is something that would be helpful to you, you can use this in the color coding to keep track of your calendar. So there's 2 ways to add calendar events. You can either add them right from the calendar by clicking Add Calendar Event, or you can add them from a patient's profile, which I will show you later. So if I click Add Calendar Event here, I'm going to choose the patient that this applies to. So I'm going to choose Bill here. You can also search. There's going to be more than 20 records that you will have, so you can search by patient name. And so I'm going to choose Bill here. And so the event type is a pre-configured list here. So you can choose whichever one is most applicable. So I'm going to put that I have to follow up. And then the event subject is a free text field, so you can put whatever you need to remind yourself of what you need to do. So I'm going to put need to follow up with PCP. So I need to follow up with Bill's PCP to make sure he attended his appointment, maybe. So I'm going to mark it as not complete, and I'm going to put it for the 17th. And now this time here is in military time, or you have to mark it as 1 p.m. or p.m. if you're using p.m. Like if you put in 2 o'clock, it's not going to put it at 2 p.m. It's going to put it at 2 a.m. So I'm going to put in 14 o'clock so it knows that it's 2 p.m. And then down here, I can add coworkers or staff members. So if I want someone to either come with me or I just want this to come up on their calendar so that they know where I am, I can add them. So I'm going to add Romelia by clicking on her name and then hitting add. And you can see that now her name shows up here. And if you want to remove her, you can always click here and then click remove. But I'm going to keep her there and click save. And so now if I go back to my calendar, you can see that now this has come up at 2 o'clock. I have this appointment. Also, if you ever need to delete an item, you can click on this red garbage can and it will delete. So that's the main functions of the calendar. I will also show you how to add them later once you're within a patient profile. This does not link up to Outlook, and it does not send you reminders, but when you do log in, it brings you to the daily view. So now I'm going to go back to my patient list, my work list and patient list. And I'm going to show you how to search and filter this list. So if I have my full list of patients, I'm going to want to search to make sure I'm going into the correct patient profile. So patient name starts with is going to be the last name. So if I want to see everyone whose last name starts with J-O, filter, you can see here I have quite a few George Johnsons on my list. There's additional filters that you can add. So if I want to add another filter and just see every George Johnson whose status is active, click filter, and now those two have come up. To remove a filter, you just click remove filter, and then delete what's ever in the top filter, and click filter again, and then everyone will show up on your work list. So you can also search by MRN, their program type, their risk, their care team members, and the patient contact number. But again, just click remove filter to remove any additional filters. And the same thing goes for the work list. You can sort it by the same criteria. And right now I don't have anything on my work list, but you could sort it by patient name as well. So now I'm going to go into a patient profile and show you the information that we have on the patients here. So I'm going to click onto my patient bill. And so the default view when you click on a patient is the patient profile. In training, this gets a little confusing because we don't have, they're all training patients. It's not real information we have on here. So it can be a little confusing, and not all of the information that we're going to get from the hospital is coming over on the training. But you can see here that the first thing you'll be able to see is the consent date and if they have one. So my patient bill does not have a consent date, so it says none. If he did have one, it would show the date that I entered in the assessment as the consent date. So it shows the status, it shows the priority, and it will show the referral source if applicable. So priority on Care Director, each patient is going to be assigned a priority, either 1, 2, or 3. The health home is not going to mandate how you use this priority. Each agency can decide how they want to use it. You know, if it's going to be on an individual care coordinator basis, or, you know, based on acuity scores, or however it is that you guys want to keep track of this. But basically, this is linked to this priority over here. So you can see that my patient bill is a priority 1. So if you click on that, you can update the priority as 1, 2, or 3. 1 is going to be, you know, highest priority, and then down from there. So if I wanted to change him to a 2, I'm just going to click Update, and it'll change it to patient 2 up there. I'm going to click Refresh, and his patient profile should update. It did, and now he's a priority 2. So you can sort by these when you're on your patient list, and also we can report off of them, but it's up to you as individual agencies or care coordinators, however your agency decides to handle it, of deciding what priority they are. You can also see here that this is Care Director status of active. So this will also match whatever's in the patient profile. So again, screening is outreach and enrolled is active. So primary program type, as I said before, is going to be those program types as described by the state that are used by CMART reports. So I will show you later, there's also a program type tab on the left-hand side here where all this information is pulled from. So you can see that his primary program is substance abuse, and he has additional programs of chronic adult, and he's a bottom-up referral. So we will allow someone to have multiple program types if, you know, they're both substance abuse and a chronic conditions. But the primary program type is going to be what we're reporting on CMART. So the risk scores here, you can see that these are all of the risk scores and acuity scores that we get from the state when we get an assignment. With bottom-up referrals, we only have acuity scores. This comprehensive assessment score here on top is going to be the FACT-GP. The FACT-GP is now housed within our comprehensive assessment. So it's scored, so you'll be able to see the FACT-GP score, but it's just marked as the comprehensive assessment score since it's housed within that comprehensive assessment. So then down here, you'll see the patient profile, patient name, MRN, date of birth, phone number, address. Also, you'll be able to see your next actions. So if you had something scheduled, so when you complete an outreach and engagement note for people in outreach or assessment for people who are enrolled, at the very end, you'll be able to schedule the next outreach and engagement note or the next comprehensive assessment. That's where the information for your work list is going to be determined. And that's what you're going to see. You're going to see, you know, outreach and engagement note due or comprehensive assessment due. And also it's going to come up here for whatever is scheduled. So his last outreach and engagement note was scheduled to be completed on September 15th. So you can all of these, all of this information on the patient profile is hyperlinked. So if you click on something, it's going to bring you to the page that houses this information, so you can change it if need be. So if you click on activity notes, it'll bring you to the activity notes within the care plan. If you click on visits, it'll bring you to the visits tab, which shows you all of the visits that the person has had within Bronx, Lebanon. If you click on admissions, it'll show you their admission history at Bronx, Lebanon. On the right-hand side here, we have more demographic information. We have their primary contact information. This information is also going to be brought over from the hospital system, next of kin, and any relevant emergency contact information. So if someone is in outreach, you will be able to have some more phone numbers and address and emergency contact information for people who you're having a difficult time getting a hold of. So care team down here, primary assigned is going to be the care coordinator. So the main primary assigned to care coordinator is going to come up here. Primary care team member is going to be the person's PCP. Again, if we have information in the hospital about the person's PCP, it's going to be pushed through, or there is a contact care team contact tab over there, which I will show you in a little bit, where you can enter in the information. And lastly, the attribution plans are going to be the actual agencies. So we are able to restrict people's views through these attribution plans. And so each organization has been designated as an attribution plan, and you will only be able to see the clients that are associated with your organization. Okay, so now that's the patient profile, which again, summary, everything is hyperlinked, so you can, it's a good jumping off point. So, you know, if you see that it's your assessment is due, you can click right on there and it'll bring you to a new assessment. If you want to see your latest activity notes, you can click right on activity notes. If you need to get in contact with, you know, their primary care team member, you click there and it'll bring you to their information. So it's a nice overall summary of the client when you first click on their name from your work list. So the next tab here on the left-hand side is patient details. So this is the same as patient details in Care Manager. It is where all the basic patient information is stored. You can go in and change things as needed if the person has moved, or the phone number is incorrect, or you have any updated information, you can come in here and change it. Something that we talked about in the trainings last week is this patient is a managed patient. This is changing and is not currently on care management. So this is used by people on the utilization management and discharge side of the hospital. So we are not going to have the ability to change this. We should, if there's information there, then just leave it. If there's no information, don't add in additional things. We can add in information under our assessments and our care plan. So patient is a managed patient. We're just going to leave this information alone. But everything else, the information up here, we can change. This Enable Care Director checkbox here is we're going to click. We have control over that on the hospital side. So again, this is being integrated with our hospital system, and so we're only going to enable health home patients in Care Director. So if you unclick this button and save it, then you will not have access to your client anymore. So never uncheck this button here. And save will save and exit. So if you click save, and it'll bring you out into back to your work list. If you just hit apply, it will apply the updated information and keep you on your current screen. So next we're going to go over the Visits tab here on the left-hand side. So there's two types of visits that are stored here. So one is the Bronx, Lebanon visits, which is information that's going to be pulled over from our hospital system. And so you can see here that at the very bottom, the first one, is a visit that was from the Bronx, Lebanon Hospital Center system. So you can see that the person was inpatient, admitted on February 7th, 2011. You can see their primary diagnosis, who their attending physician was, and you'll also have access to their discharge plan and the patient information that was given on that visit. So right now, since we're in training and this is a dummy patient, he doesn't have discharge planning, but normally if you just click on this discharge plan document here, you'll be able to get the discharge plan. So in addition to the Bronx, Lebanon visits, you'll be able to add in visits for you to keep track of if they go to, you know, a community PCP that isn't associated with Bronx, Lebanon, or, you know, they're going somewhere else for, you know, certain specialty appointments or whatever it might be, or they don't come to Bronx, Lebanon at all. You'll be able to keep track of their information here. So the way that you can add a visit is click Add Visit up here. And so the admitted date is going to be either the date that they were admitted inpatient somewhere, or if it was an outpatient visit, you can just put the date of their appointment. So I'm going to put it as September 15th and with no discharge date, since I'm going to say that it was an outpatient visit. So organization, I can say that they went to Smith Family Practice, and the provider was Dr. Smith. Reason, check LDL and blood pressure. And then patient type, I'm going to choose outpatient. And so outcome, you can either choose complete, partially complete, or not complete. So if you want to put in, if your client tells you that they have an appointment in 2 weeks, and you want to save that here and put it as not complete, and then move it to complete if they did come, or if you just only want to put in appointments that they did attend, you would hit complete and hit save, and it will show up on your list here. Now, if you need to go in and edit, like if you put that there was an appointment in 2 weeks and you put it as not complete and now you got confirmation that your client attended, you can click Edit and change the status or change anything that you need to, and click Save. If you entered something in by error or your patient made an appointment but then didn't show up, you can delete the visit if you want by clicking on the trash can next to that visit. Only appointments that you add manually you will be able to have access to edit and delete. The information that's coming over from the hospital, you won't be able to edit in any way. Okay, so the risk tab is where we're going to be having all of those acuity scores and the risk scores that the state sets up. So I will be uploading these via the patient upload when we have assignment lists. So there's not going to be a reason to add risk scores manually. The most recent risk score will show up on the top here. So the most recent risk score here is the Health Home Comprehensive Assessment Note. So that is the note where the FACT-GP is stored and scored. So the entire note is scored as the FACT-GP score. So it will show up as a comprehensive assessment note since that's the name of the note. And the risk score is going to be the score of the FACT-GP. And then you can see as of date is going to be the date that you completed the assessment and the FACT-GP. And then if you go down here, you'll be able to see a history of all of the risk scores entered. So you can see the acuity scores, and we'll also put them in a range of high, medium, and low. And if it is a top-down referral, we'll have those other scores like the outpatient rank and the DOH rank. So the next tab is the Care Team tab. And so the Care Team is going to be a way that we can keep track of a person's clinical providers. There's a different tab for keeping track of just contacts that are, non-clinical, like family members, anyone who helps them out. But this is for clinical care team members. So you can see here that this person has 6 people down as being part of their care team. So you can see that 4 of them are from Bronx, Lebanon, and 2 of them are from outside family practices. So if the provider is within Bronx, Lebanon, we are going to be uploading a address book. If they're within Bronx, Lebanon, or one of our partners, our community partners, where we have, all of their demographic information, like phone numbers, addresses, you'll be able to look that up and add it. If it's someone who is not associated with Bronx, Lebanon, you can add that information in manually. So a way to add someone who's going to be in the care team address book, which is going to be providers that are associated with Bronx Lebanon, you would click on the care team address book. And so you're going to be able to filter and search for physicians and clinical care team members. So I'm going to add a filter, and I'm going to say, it's Dr., and his name starts with a T-O. And then I'm going to hit filter. And so anyone in Bronx, Lebanon that their last name starts with a T-O will start. So I'm going to say that this is their care provider, and I'm going to click Save. And so now you can see that he has been added to the care team. You can also mark the primary care team member. So right now you can see that Mark Greenberg is marked as the primary care team member, and that's the name that showed up on the patient profile as the primary care team member. If that needs to change, all you have to do is mark a different care team member as the favorite here by checking off the star. So if I want to move it to now Smith, I'm going to click on the star. And now you can see that the star is there and his name is in bold, so he is the primary care team member now. Now to add a care team member that is not in our address book, you would click Add Member, and you can add in their information. So I'm going to add in and you can add in address, phone numbers, anything you need. The only things that are required are first name, last name, and organization. So now you can see that he has come up on my list here. So if you ever need to edit someone, if you added in the wrong phone number or address, you can click on the pencil to edit, or again, the garbage can to delete. Okay, so the Documents tab has a function where we can upload documents the same way you would attach a document to an email. So we can add in PDFs or Word documents by clicking Browse, and you can, as long as the document is saved to your computer, you can choose it, put the document name, any comments, and then choose a document type. Right now we only have consent form. We're going to be configuring this list. When we get information on bottom-up referrals, we can add in information here for you, or if you want to securely save information that you have in a paper form, you can scan it and then upload it here, so you don't have to worry about PHI leaking. However you want to use it, or if we need to send you documentation, we can send it through the system. Well, we would send you an email and say, we added in some information on the client. It's under the Documents tab. We often get consent forms for our bottom-up referrals, and we can now send them this way. So you would just click that and click Upload, and your document will save here. Okay, the next tab is the Contacts tab. Okay, so data has changed. Do you want to save? I'm going to click No. So the Contacts tab right now in training, there's a bug, and we keep getting errors. So you can't see anyone on the Contact tab. However, the Contacts tab is used to keep, patient, family, friends, anyone who's helping them, pick up their meds, helps them for a few hours after work, or whatever it might be. So if you need to add in contact information, you would click Add Contact, and then just enter in their information here. I'm not going to enter it now since we are having this glitch, this error with the Contact tab, but the only required fields are first name, last name. You can put in their phone numbers, address, whatever it is that you need. and you can add in the relationship to the client. So the next tab is the Patient Note tab. This tab is going to be used for the health home to send information down to the agencies. This is not used for documentation for care coordination activities. So, for instance, when we get phone calls on our hotline line, or there's an outreach client that got in touch with us to let us know that they're interested in enrolling, or anything like that, we can add in a patient note, and we'll send you an email that says that we added a patient note on this client. Please take a look at it, and we can update phone numbers this way, or give you any information that they might have given us. So you can filter through all of them. But there's two note types, a regular note type or a phone call note. And then you'll be able to see the data is entered, who was created by, the type of note, and anything that we'll add. It might be outreach client interested in enrolling, please call. And then we'll put their phone number, whatever it might be. But again, this is not used for care coordination documentation. Care coordinators, agencies should not be using this function to make any notes or documentation. Okay, the next tab is the Assessment tab. So we have consolidated our assessments down into two different notes, the Outreach and Engagement note and the Comprehensive Assessment note. Contact notes are no longer. The contact notes are being replaced by activity notes that are held within the care plan. So outreach and engagement notes are used when a client is in outreach. And it is filled out for a last time when the client does engage. You'll put in their consent date there, and then you'll move on and create a care plan and enter in your activity notes there. The comprehensive assessment note is the assessment. It is more comprehensive now, and it includes the FACT-GP. So we've added in a functionality so that you can either do a full assessment update or you can do a partial assessment update. And so you can now copy both the outreach and engagement note and the comprehensive assessment note so that you can just kind of push forward any information you need and change whatever you need to change and keep things that are the same. So you can see here that this is a list of assessments that are done on this client. You can see the name of the notes. The scores are going to be on the comprehensive assessment note if the FACT-GP was completed. You can see if they were completed or in progress. So we're going to require that all notes are saved and locked. So if they're saved and locked, they will be completed. If they are not saved and locked, it will still say in progress. The reassessment date, there's new functionality on the assessment and the outreach and engagement note where you will be able to schedule the next time you need to do outreach or the next time you need to reassess a client. And so this will come up on the reassessment date, and it will also come up on your work list. So you can see who was last modified by, the last modified date. You can go and edit notes that were not saved and locked. You can view the note, and you can copy the note. And I will have the functionality of deleting the notes in case there's anything that was entered in incorrectly. You can send me an email and let me know, and I will delete the notes. And another new functionality is that the deleted assessments will show up on the bottom here. So they will be gone. We won't be using them for reporting purposes, but that way we can keep track of things that were deleted. So I'm going to show you how to add an assessment now. You click on this dark blue panel up top here that says Add Assessment and choose Add Assessment. So again, there's only two assessments to choose from, the Outreach and Engagement Note or the Comprehensive Assessment Note. So I will be sending out paper versions of these notes. We will be changing them up until next week. just a few things here and there, but I will send you the paper version so that you can have them for your records and get used to them, and also take them out in the field if needed. So I'm going to click on the outreach and engagement note, and I'm going to click next. So you can see here that all of the different sections of the outreach and engagement note are coming up on the left-hand side here. If there's a red dot next to a section, that means that there is at least one field in that section that requires an answer. If there is a gray button little next to the section name, that means that there are no required fields in that section. So I'm going to go through and fill out the first section here, contact date, and go through. I'm not going to go through the whole assessment. It's very similar to the one that we currently have. So I filled out all the fields here, so I'm going to hit section completed and next section. So when I do that, the red circle that was next to contact information now changes to a green circle with a checkbox in it. And if you scroll over it, it says section is completed. So now you know that you don't have to go back to that section. Everything is completed. So I'm going to keep going and adding in my information as needed, and click next section completed. Oh, section completed and next section. So now if you only click next section, it'll come up as green but without that checkbox. So you can also, the green circle just kind of means you have visited that tab. So I just went from pre-screening, and although I didn't fill anything out, it knows that I visited that section, and it changes it to green because my required questions were answered. But the checkbox means my section is complete. So in the interest of time, since I've completed all of my required questions, I'm going to save and lock my assessment. So right now, this is where you can schedule the reassessment. So if I have done my outreach and engagement note and I was unsuccessful, but I want to try outreach again next week, I'm going to schedule my next assessment as my outreach and engagement note and schedule it for the 23rd. Or I'm going to choose today so that it comes up on my work list. So I'm going to choose today, and I'm going to click Save and Lock. Now it'll bring me back out to the assessment view, and you can see that my outreach and engagement note was completed on September 16th. And so the next time I complete an outreach and engagement note, if I just want to copy my information and change what I need to, I'm going to click on this copy button right next to my outreach and engagement note. And that'll bring me in here. If you are copying information, especially when using the assessment, because that's very comprehensive, always make sure that you change your contact date. If you do not change your contact date, your new information will not be used for reporting. So always make sure you change your contact date and you change any relevant information. But you can see that all the answers that I completed last time are already pre-filled in. So I'm going to cancel out of here because I don't want to fill out another one. And I'm going to show you how to print these notes. So if I want to print multiple notes at the same time, I can just check all the notes that I want to print. Or if I want to print all of them, I can use this top box on the blue panel. So let's say I just want to choose these 3 notes here. I'm going to click 4 rounds. Okay, so the 4 rounds make a kind of nice view. They don't include too much information, and they don't include any questions that I did not answer. So you'll see a short, comprehensive, condensed view of these notes on one page. If I click the 4 chart view, it will break down the assessments each on a different page and include the patient information. Like so you can see here, you have my patient name, address, all the demographic information there, and it's on 4 different pages, 2 for the outreach and engagement notes each, and then their comprehensive assessment note took up 2 pages. So it's 2 different views. A quick view if you just want to read it on the computer screen is 4 rounds. If you're printing something out either for a paper chart or for a provider, I would recommend the 4 chart view. Also for agencies that are on Care Manager now, these are the current patient assessments, but if you click on patient assessment history, you're going to see all of your assessments from Care Manager. Okay, so the next tab is the Program tab. This tab, again, is where we're going to be designating which program type the patient is based on those program types as outlined by the state that are used for CMART reporting. So you can see that my patient is, his primary program is health home substance abuse. He also has chronic adult, but is not his primary, so that will not be reported on CMART. And he's also a bottom-up referral. We were going to have different chronic illnesses represented here, but since this information is printed out on the top of assessments and lots of information, we decided not to include that to avoid any issues with PHI. So you can see that these programs that are in italics are actually inactive programs that the patient was once associated with, but is no longer associated with them. And so I marked the primary program by, again, the star here on the left. So if I want to change him from his primary program from substance abuse to chronic adult, I can do that, and it will ask me, are you sure you want to change it? I'm going to click OK, and now his primary program is chronic adult. So the primary program is always going to be one of these health home designated ones. The bottom-up referral should never be the primary program. If I want to add a program, I'm going to click Add Program and choose these are the different program types that are outlined by the state. Just click on one and click Save. And now you can see that was added to the list. Okay, the next tab is the Financial tab. We went over this a little in the training last week for those supervisors that were there. The payment sources will be coming through from the hospital registration system, but we're not going to be using that, and we're not going to be adding in information there. We have, dual recipients or, people who used to have different insurance. It's going to be anything that was ever registered in the hospital system. So it could get a little confusing, so I don't recommend looking at that payment source tab there. However, the attribution plan is going to be the agency that that is assigned to this client. In addition, this is where we're going to be keeping track of whichever managed care plan there is. So if I want to add an attribution plan, you can see we have all of the agencies listed here, but we also have our managed care plans. So if I want to say that this person is Affinity, I'm just going to choose that and click Save. And now it will come up on my attribution plan list. Any information, this is all in the assessments again, and we will be creating a program so that anything you add in the assessments that would affect this will be generated. It's going to run every day at midnight, so it won't be automatic, but it will. The next day it will be updated. So the next tab is the Assigned Users tab, and again, this is just a separate way to add an assigned user. We went over before how to change the assigned users in bulk, and this is how to just change it within the patient profile. If you only want to change it for this one patient, you can. All of these people are assigned to him since we were just assigning people for training purposes. So if I wanted to unassign some people, I would click on their names and then click Unassign User. And again, you can enter in your reason why or not and click Save. Now, if I want to add users, I'm going to go down and click a couple people and click Assign Users, and they'll be brought back up to the assignment list. So you'll be able to see here, too, the number of care coordinators that are assigned to a patient. Obviously, it's going to be less than this, since I tried to assign everyone who was at the training last week to certain patients. So you'll be able to see who's assigned and who's not assigned. Now, the primary care team member who is going to show up on that patient profile is going to be designated by the star again. So you can see that Cindy from Allscripts is designated as this person's primary assigned user here. But if I wanted to change it to Romelia, again, I'm just going to click the star. It's going to ask me if I'm sure that I want to do this, and I'm going to click OK. And now Romelia is the primary assigned user on this patient. The next tab is the Enrollment tab. The Enrollment tab is going to have a view of all of the dates that the person was active, inactive, consent dates, enrollment start dates, and any opt-out dates. So again, if this information is added into the assessment, which it should be, it will be automatically generated here. However, if it's ever incorrect or we need to add something in, you can also add it in manually. So you can see on the bottom that there's going to be a history of the different statuses and dates of those statuses. So for instance, if someone is in outreach and also known as screening and care director, once you add in that consent date or that enrollment date, it'll show up on the bottom. If you make them inactive, it will then have an enrollment end date as well as the enroll end reason, and it'll change the status to inactive. So then let's say the person shows up on our assignment list again, and now they're going to be in screening. It'll move it back into screening, and it'll show up on this list as well. There's also, you can change the status from here, of whether they're active or new or not started. You can add in your enrollment dates. You can add in your consent dates. You can upload the consent form right here. It'll bring you to the Documents tab. Or you can add in your opt-out date and reason, or enrollment end date or an enrollment end reason. So that is the Enrollment tab. The next tab is the Clinical Data tab. The Clinical Data tab is going to bring over information that we have on the hospital side. So for right now, we don't have any information coming over on these patients because they're fake patients that we just use in training. But once we get into our production site, you'll be able to log on and see order results and transcriptions. So order results will have blood work, different and different results that were ordered from any hospital stays. So we should be able to see, cholesterol here, blood sugars, and stuff like that. In addition, in the transcription, we're going to be able to see discharge planning, history and physicals, and assessments done by the physicians and social workers if they're inpatient. So if you have a client that you know is a very high utilizer and has had a ton of inpatient stays and ED visits here at Bronx, Lebanon, when you first click on this tab, it might take a minute or two to load. Please be patient. It means that it's just making the connection and getting all the information over. But then once it connects that initial time, it should be much faster each time you go in and look. And this will be updated in real time. So if you have a client that's, currently in the ED or, currently inpatient, you should be able to see any of the active transcriptions. As long as they're signed by the physicians, they'll then be moved over into Care Director. So last but certainly not least is the Care Plan tab. So again, care plans are going to be where all of the documentation is happening for enrolled clients. So if you have an enrolled client, the first step after you do your assessment is to create a care plan. So once your assessment is done, within the first 30 days of enrollment, you're going to want to go to the Care Plan tab and create a new care plan and start documenting within that care plan. So the notes are what we used to call contact notes are now called activity notes. And activity notes are going to be associated with different parts of the care plan. So the care plan is a problem, goal, and intervention model. And so the activity notes can be associated with one or more interventions. And the care plan is meant to be a living document. And, problems added and changed and made inactive as needed. And, the activity notes are just constantly going into the care plan. So you can see here that this person has 2 care plans, and that's something that you never want to see. There should always just be 1 care plan. Because this is training and I've been working on this client, I've added a couple different care plans to him. But once you add a new care plan, you should always go back in and be editing the same care plan and changing the problem, goals, and interventions and adding in new activity notes. You should never add a new care plan if there's already an existing care plan. So the first thing I'm going to do is go into my pre-existing care plan and show you how you would edit it. So this care plan, I'm going to click on the pencil all the way to the right here that says Edit. So you can see here, I have my problems, goals, and interventions. If I collapse all of my problems, goals, and interventions, I'll only see my 2 problems that I have on this client on the current care plan. So when you first go in, it's easy to collapse and see what you have on this client already. So if you want to expand all, you would click Expand All, and it'll bring it back out. So you can see that I have 2 problems, I have 2 goals, and I have these interventions under this goal here. So I currently have no activity notes on him because the activity notes will show up under the interventions. So let's say that this is the first time I'm working with this client. I just got him to enroll, and I did the initial assessment, and now I'm creating the care plan. So I've created the care plan. I brought in my problems, goals, and interventions, and now I want to add in a contact note, or excuse me, an activity note. I'm going to click Add Activity Note, and the activity notes are very simple. So I'm going to say my note type was in person. I contacted him on the 15th at 12. Person contacted, I'm going to say, is the client. And the outcome was I contacted the member and my attempt was successful. So I'm going to put my note in here, and so obviously you're going to put in your notes. And then I'll be able to choose the interventions that this note is associated with. So this is also a new feature from the old Care Director, because this is also a new release. So obviously when you are doing your activity notes and you're out and working with your clients, you're not just working on one intervention at a time. So now the activity notes, we're able to pick and choose which interventions the activity notes are associated with. So let's say I, in my work with the client on this day, I did these 2 interventions. And in my notes, I'm going to obviously put down what it is that I did to help these interventions, and I'm going to click Save. So now you can see my note has showed up here, 9:15, 12 p.m. in person, and I put in whatever it is that I did. So as you can imagine, once you get all of your problems, goals, and interventions, and you're putting what every note is associated with, this care plan can get pretty long. So if you want to see only your activity notes in chronological order, you can click Show Activity Notes Only. So now you can see that I can just see my activity note, comes up one time, and I'm able to see what it says here. You can also go in and view the activity note, and it's not editable since I already saved it, but you'd be able to see the full note here. I'm going to click Cancel. And so now if I want to go back to my full care plan, I'm just going to say Show Activity Notes Only. So as I said, this care plan is meant to be a living document of the current problems, goals, and interventions. So we're going to want to add in problems, goals, and interventions as needed. And so I can already tell that down here, there is one problem that I have. Patient has barriers to performing daily living activities, and the goal is to improve the ability to perform daily activity livings. So if I had created this, I need to add an intervention so that I can help this client meet this goal. So if I click on Add button here, it'll automatically go down to the intervention level since I'm adding something under the goal. So I'm going to click Add. And it'll already know which interventions are associated with that goal. So I'm going to say that I want to coordinate a referral to a community or social worker. And I'm going to click Save. Outcome is required. So we're still configuring what is going to be seen here on the intervention and the goals. It won't be this full list here. We're going to try to make it a little bit more simple, a little bit more user-friendly. So you also won't have to choose an outcome right away. But I'm going to choose that right now it's not complete since I still need to work on it. So I'm going to click Save. And so now I have an intervention here. So you always want to see problem, goal, and intervention. When you're configuring a care plan, always bring over a problem, goal, and intervention. If you're going to bring over a problem, bring over the goals and the interventions because you won't be able to document unless it's under an intervention. So you can see here that I easily just fixed that because I had my problem, my goal, but no intervention. And then I just clicked on Add, and I added in the intervention. So earlier I showed you how to add an activity note so that from up here, but you can also add activity notes using this plus sign here, Add Activity Note, and it'll automatically put it under that intervention. I like to get in the habit of adding it from up here so that you can associate it with multiple interventions because usually you're working on more than one intervention at any given time. So again, when clicking the Add here, it'll automatically add a goal if you're under the problem. If you're under the goal, it'll automatically add an intervention. But if you want to add a problem, you go up here and click Add Problem. And so then you'll be able to see the full list of problems here. So we put in this bold here, the different problems, so that it gives a short version so you don't have to read through all of the problems. You can, go through and see what looks like is applicable to this client. So let's say I know this client has deficits in disease knowledge. I'm going to click on that, and I'm going to click Next. So then you'll be able to see the problems, goals, and interventions that are associated with this problem. You're going to see his full care plan on the right side, and now this new problem, you're going to see the problems, goals, and interventions that it's associated with. So if you want to bring over this full problem, goal, and intervention, you'd click on this top box and it'll highlight everything. But let's say, this problem has several goals. So I'm just want to bring over 2 of these goals and the associated interventions. Then I just click on the ones that I want, and I click Add to Care Plan. And now you can see that these are now added to the care plan. And if you brought over something you don't want to, let's say, you know what, actually I decided I don't like this intervention, it doesn't apply, so I'm going to remove that intervention from the care plan. And now that's gone. So once you're satisfied with what you brought over, click Finish. And now you can see that my new problem of disease knowledge and self-care has been added with my associated goals and interventions. So in addition to the problems, goals, and interventions, there's always going to be barriers to healthcare, and care coordination in general. So click Show Barriers up here, and you'll be able to add barriers. So if the client speaks Spanish only, you can choose whatever the barrier is, and you can add as many as you want. And so you can edit them by clicking the pencil here, or delete them by clicking the trash can. And you can always hide the barriers so that you have more room here to see your care plan. So, again, as part of the care plan being a living document, there's going to be times where you reach your goals and the problem is no longer valid. So let's say that the patient had deficits in his disease knowledge, but you've done the education, and now the patient is well educated on his diseases. I can go in and edit the problem and choose active and change it to no. So I'm going to click Save. So again, we have different things here that we've made required that aren't going to be required. And so now that disappears from the care plan. So it doesn't really disappear, but it saves as an active. So all of your activity notes that were under there will be saved, and they'll still be under the Show Activity Notes only. And if you want to see your inactive problems, you can click Show Inactive, and your problem will show up in italics. So once you make a problem inactive, the associated goals and interventions will also become inactive. So you can see that when I click Show Inactive again, all of those problems, goals, and interventions are going to go away in that view. So occasionally you might want to print the care plan for the client, and so that they can have it, or print it to give it to a care provider. So we're going to click Print. Print for Patient is going to print out patient-friendly versions of the problems, goals, and interventions. So each one we're going to have a patient-friendly version of it, and you can also edit those, and that way the patient can have a simple, clear version of the care plan. So you can also choose the problems, goals, and interventions that you do want to print. So you can see that the inactive ones do come up. So let's say you can either choose that top box again to print everything, but let's say I only want to put in the active ones on this care plan. I'm going to choose problems. So if you go to the notes too, it'll automatically choose everything that's associated with it. So I just chose all of my active problems, goals, and interventions, and now I'm going to click Print. And so you can see that it comes up in a nice little summary on top, care team members, and then the care plan down here, as well as your notes. And so the care plan details, you can see who it was created by, when it was created, when it was last modified. And you can also export these into PDFs or print them off. So now I'm going to choose the back button to go back to my care plan. And I'm going to go back again to go to the main care plan page. Okay, so I just showed you how to edit a pre-existing care plan. But let's say that this is the first time that you're working with this client and you need to add a brand new care plan. So again, if you see something that looks like this where someone already has a care plan, do not add a new care plan. Always keep working from the same existing care plan. But let's say that this person does not have a pre-existing care plan and you need to create a new one. You would click Add New Care Plan. And there's only going to be one care plan template, the Bronx Health Home Care Plan. And so then you're going to click Next. And so then every problem, goal, and intervention that we have configured on the system is going to show up here. So the best way I think to do it is to collapse all of the information so that you only see the problems. And again, we put these short versions of the problems in capital letters so that it would be easier to see the problems that are applicable to a client. So let's say I know this person needs PCP, then it'll expand and you'll see the goals and interventions and you can bring over whatever applies. I know that this person is in behavioral health crisis. I'm going to click on that problem, goal, and intervention. Getting a little click happy, I'm sorry. Okay. And so as we're getting started in Care Director, obviously no one has a care plan configured yet. So we're not expecting that, day one, everyone has a care plan configured. What we do recommend is that you go in and you can configure the care plan as needed. So you can start with one goal, one problem, goal, and intervention, and then add on as needed. Within the first 30 days, everyone should have some sort of care plan developed since we need to be making monthly contact with our enrolled individuals. And then as needed, you can bring in the problem, goals, and interventions by editing the care plan. So I am going to just choose those two problems and click Finish. And so that'll bring me right to the care plan page that I showed you earlier. And you can see I have my problems, my goals, my interventions, and now I can go in and add my activity notes as needed. And again, there's two ways to add activity notes, right from the intervention or to go up here and click Add Activity Notes, and that is the way that I recommend that you do that. So that is the processes for Care Director. Again, I will be recording this webinar, and I will be sending it out to everyone so that everyone can watch this if they were unable to make the webinar today, or if you can rewatch it if you want. I will also be holding a webinar on September 22nd, which is a Monday, from 2 to 4 p.m. I will have it be more open. I don't think that we'll have as many attendees, so I won't be putting people on mute, so we can answer questions. Then I will have another webinar on the 29th, which is another Monday, from 1 to 3. Same thing. Come and please watch the initial webinar before you come onto these question webinars so that you have an idea of what the system is going to be like, and so you can ask your questions. So a few questions that we have for today. Is the FACT-GP. So the FACT-GP is still only needs to be updated annually, but it's housed within that comprehensive assessment. So when you're doing a full update, you can update the FACT-GP, but if you're just doing an update of the assessment as needed, you do not need to do the FACT-GP again. And so when I send out the documentation, that will become evident. There is a full update of the assessment and then a partial update that you can also do. So another question was about activity notes. Activity notes are fully replacing contact notes. There are no contact notes. There are no, other way to document your routine visits or or care coordination with your clients. So everything needs to be documented within activity notes within a care plan. So that means that really we're looking for the assessment to be done within the first 30 days and for that assessment to inform your care plan, which should also be done within the first 30 days. And then your activity notes can be added to that care plan, and you can associate them with the interventions as needed. So there's a question about outreach notes. The outreach notes will not be under the care plan. We don't expect the care plan to be configured before someone enrolls. The outreach notes the outreach engagement notes are to be used whenever outreach attempt is made, whether it's successful or unsuccessful. We'll document that in the outreach and engagement notes. So we had a question about the care plan, about configuring something for an other. So we are going to be adding an other so that we can add in activity notes for something that is unrelated to the care plan. So we are really trying to make this care plan extremely comprehensive, and I'm going to send out again the Excel version so everyone can take a look at it. And so I think what we're going to do is have others under problem sets so that we can at least have the activity note go back to one of these problem sets, because again, we need to be making sure that our contacts are associated with one of those 5 core services that the state has outlined, so that we know that if something was billable, or what to document it under for CMART reporting. So again, these are we try to be very comprehensive on the problems, and it includes a lot. So if you feel like there's something missing, please let us know. But we will be including one other, but we highly recommend that you try to make your activity notes fit within the care plan, or at least associate them with something in the care plan. So that is it for today. Again, I will send out this webinar. Please have all of your staff and coworkers watch the video, and that way we can go over questions on the next 2 set of webinars, which I have sent out invitations. So thank you so much for joining. I hope that this was useful. And again, if you have any additional questions or questions about the assessments or anything, please feel free to call me or send me an email, and I will try to get back to you as soon as possible. So thanks so much for joining. Have a great day. Bye.